Hello, I'm Juliette McGrattan, back with another running health tip for you. Today I want to talk about cystitis. I don't know if you've ever had it. I have, and it's really grim. You're bursting for a wee even though you've just been. When you do go, just a tiny dribble comes out and it stings and it burns and you've got tummy pain and it's really, really horrible. So the question I wanted to address today is whether running can cause cystitis. Cystitis is very common, but are there things about running that make us more likely to get cystitis? So cystitis itself the word means inflammation of the bladder. Itis on the end of anything in medicine means inflammation. And that can come from either infection, which is usually a bacterial infection in cystitis, or from irritation. Both irritation and infection can cause inflammation of the bladder, and then you get those cystitis type symptoms. Now, bacterial infections usually come from bacteria which are on our skin that have travelled round from our anus round to the urethra, which is the little tube that brings the urine from the bladder to the outside. And irritation can come from all sorts of things. And this is where I think running actually may have a role to play in some women's cystitis. And I say women's because cystitis is much more common in women than men. So how can running cause it? Well, first of all, the first thing could be because of the repetitive movement of running and friction of clothes against the urethra. The urethral opening where the urethra comes out to the outside is in the vulva. And if your knickers, your shorts, your tights are repeatedly rubbing against that, then it could cause discomfort and cystitis type symptoms. The second thing is that as runners, we probably have more baths and showers than the average person. You know, you have your daily one, whatever, and then you have your extra one when you get in from your run. Now, we know that washing too much can strip away natural bacteria, which are there to keep a healthy balance. Once they're gone, it's more likely that unhealthy bacteria are going to grow and can cause problems such as a bacterial cystitis. But also, if you're using a lot of perfume products, shower gels, soaps, even deodorants in that area, then they themselves can cause a chemical irritation of the urethra and also give you cystitis. The third one, a little bit more unusual, is that running, as I say, is a repetitive movement, and it's possible that the walls of the bladder could slap against each other when you're running and cause irritation and inflammation of the bladder lining, giving you cystitis symptoms. The next one, again, thinking of irritation of the lining of the bladder wall and the lining of the urethra, is if you are dehydrated. When you're dehydrated, your urine is more concentrated and therefore more likely to cause irritation. And the final thing is if you're overtraining. We know that if you are running excessively, more frequently, more intensely, not having enough rest and developing overtraining, then it can lower your immune system. When you have a lowered immune system, you're open to all types of infections, and cystitis could be one of those. So I definitely think there are things there that might make a runner more susceptible to cystitis. So what can you do about it? Well, thinking through that list, you can make sure that your clothes aren't rubbing. You might want to go commando and leave your knickers at home. Be careful when you wash. You can just use warm water in your genital area. You don't need to use lots of soaps and bubble baths and things. It is self-cleaning, and it's better to have a shower than to wallow in a bath to prevent cystitis. Make sure you hydrate properly, so that you're drinking plenty before, during, and especially after your run to get your urine back to that nice sort of straw colour. And be sensible with your training. Make sure that you're giving yourself enough rest and you're building things up gradually so that you don't overtrain. Top tips for everybody, not just for runners: always pee after you have sex. That makes a big difference. And always wipe from front to back when you go to the toilet. If you get a cystitis, you can treat it yourself usually. Takes about 3 days to disappear. Lots of fluid, paracetamol if you're achy, hot water bottle, and you could visit the pharmacist to see about getting some sachets of potassium citrate, which actually help to normalise the pH and reduce the acidity of the urine. Cranberry juice can do the same. Those things, cranberry and the little sachets and things, are a little bit controversial. There's not massive evidence that they work, but anecdotally I do know that lots of women can get some relief from them. But importantly, if you're not getting better after 3 days, if you've got blood in your urine, you have a high temperature, you feel unwell, you've got back pain, suggesting that the infection might be spreading up to your kidneys, you're pregnant, you're a man with cystitis, then in all those situations, and if you're just not sure whether or not it's cystitis, maybe you've never had those symptoms before, in all those situations, then you should speak to your GP. So I hope that's helpful. That's a quick whirlwind tour of cystitis for runners. There's more about this in my book, Run Well, Essential Health Questions and Answers for Runners. So please do skip off to my blog, drjulietmcgrattan.com, for more information about the book and more healthy running tips. Thanks very much, and I'll be back next week.